Good evening, everyone, and welcome to this UEFA Medical Webinar supported by European football clubs. It's great to see many of you joining us live today, and whether you're working in a club environment with a national team or in research or clinical practice, you're very welcome. And tonight's topic is Ramadan and player health. This is a topic that comes back every year in football, and it's one that often raises questions, uncertainty, and sometimes also strong opinions. It sits at the intersection of faith, physiology, performance, and care, and that makes it important, but at the same time also complex. Like some of our recent UEFA medical webinars, tonight's session is deliberately not presentation-based. There are no slides, there are no lectures. Instead, we want to use this hour for an open and honest conversation, a conversation grounded in real-world decision-making, which is what we encounter on the pitch on a daily basis for most of us. Our aim tonight is also not to provide you with a single protocol or a checklist, and it's not to tell you what you must do. Rather, we want to explore what we know from research, what we see in clinical practice, and how Ramadan is managed in the daily reality of football environments. Importantly, this discussion applies to both men's and women's football, and we will refer to both throughout the session, and where relevant, we'll highlight where experiences, risks, or management considerations may differ. You are very welcome and encouraged to submit questions throughout the session using the YouTube chat. I'll keep an eye on them and bring them into the discussion where they naturally fit. And our speakers tonight are also on the lookout for any further questions and comments you might pose that we cannot answer directly into our discussion. So without further ado, I'm very pleased to be joined tonight by three guests who bring highly complementary perspectives to this discussion. And rather than full formal titles, I'll frame them by perspective, because that's how decisions are actually made in football. First up, we have Juan José Morillas. He's the head of sports nutrition at Paris Saint-Germain. He will provide us with a football practice perspective tonight. Hi, Juan. Thank you for joining us.
Hi, all. Thank you for inviting me.
Next up, we have Karim Chamari from Nafar Center in Doha, Qatar. He provides us with predominantly a research perspective, but also with a lot of experience under his belt. Hi, Karim. Welcome. Thank you.
Hello, everyone.
I know it's a bit later in Doha, so we're eating up your family time, but thank you for that. And finally, but definitely not least, Professor or Dr. Irfan Ahmed, sports medicine physician from the UK, London, and providing us with primarily a clinical perspective. And together, I think these perspectives reflect how most of us work in real life. Evidence informing care, care informing decisions unfolding in complex human, cultural, performance environments. So thank you for being here, and thank you for being willing to engage in this unscripted conversation. Maybe a bit menacing without any slides or something to hold on to, but let's make it natural. So let's set the scene maybe first before we have a few cases to talk with. And I want to start with a question for all of you. When Ramadan is approaching, we're just a few weeks away. What is the first question you tend to hear, or the first question you ask yourself in your respective roles? And maybe the practical perspective here may be the best one to start. Juan, can I start with you for this question?
Yeah, for sure. Well, thank you. To me, it's an honor to be with Dr. Ahmed and Karim. So let's see. I think I'm going to learn also today. Well, the first thing I heard all year is, hey, can you help me, please, with this thing? Because I think because I'm more close to the players, they are scared that their health and performance be impaired. So this is the first question, like, hey, what I have to do to continue at the same level of performance? This is the first thing. Yeah. They are scared about this.
Yeah, I can imagine that. Irfan, what is the first that comes to your mind from a clinical perspective?
Yeah, thank you for the question, Eva. I guess as a sports medicine physician working within that multidisciplinary and interdisciplinary team, my first thoughts are preparation. And when I think about preparation for our Ramadan fasted athletes, as Juan mentioned, we think about starting that preparation quite early. We tend to think about screening for medical conditions and how we can optimize training around specifics. And we're very keen to implement a periodic health evaluation that helps us understand those challenges well in advance, so we know what their training schedule is like. We'll go to some of those challenges from a clinical perspective, but really understanding what are the environmental challenges, what's the training and game time, and also are there any patient or athlete specific factors which we'll need to work around, and hopefully we'll go into more detail around that. But preparation and certainly doing some level of health evaluation, generally a month before, to understand those training needs, and we'll go into more detail about that later.
So that already highlights the complexity of Ramadan and player health and well-being. I think great answer. Karim, if I ask you the same question.
If I speak as a researcher, already we have the problem of Ramadan happening only once a year. So you have to really be ready when you want to run a research protocol. With the pre-Ramadan measures, mid-Ramadan, end of Ramadan, and post-Ramadan measures to be done in somewhat challenging conditions, because, for example, after Ramadan, there is the Eid break, which is the festivities after Ramadan, where people eat again and are happy in family, and they might fly away and go abroad. So finding your participants post-Ramadan is also challenging. So there are some methodological challenges that we will certainly be debating during this speech today, that explain sometimes some conflicting results. Is Ramadan bad for performance? Yes and no. You will see this during this hour. And also the other question is which protocol are running where I am, away from where I am with other colleagues. We might be working on data from last Ramadan or the 2 Ramadans away. And the other question is, who will invite me to be speaking? Yesterday I was speaking at the BIMA, British Islamic Medical Association. Today I'm speaking at the UEFA. The FIFA contacted me. So this is also a question where people forget me for 1 year, and then all of a sudden Ever says, hey Karim, can you come and speak? Just to make it fun.
Yeah. Well, it's more than just to make it fun. It's really important information. And Karim, I understand. Yeah, it's only once a year, but that doesn't mean the knowledge should not be there all the other months, I guess, because it's also preparation and in a part probably recovery. What we just heard from Irfan as well. And there was something really interesting you said, Karim, in your answer. It's not just about the fasting itself. There's also other aspects around Ramadan that we need to consider, which is the fasting during the Ramadan, but then there's also thereafter the festivities. How does that, Juan, impact from your perspective and your experience on players' well-being?
Well, in this aspect, I have to say that we have all kind of answers, because we have the players that usually follow the protocol, the strategies, the instructions very well, and because they concern about their performance and health. And we have a few that probably they prefer to do the party night at home with the typical food in Ramadan. That is a problem for the nutritionists for sure, because we try to avoid gastrointestinal problems, and we are eating a lot of fat, for example, at night. It's an example. So we have to try to explain the players that if you continue doing that during all the month, from the second, third week, you will have a negative impact on the field. So all they will think we will think they will have. After there are markers, there are a lot of things that we can measure, but try to make understand to the professional players that we have to follow the protocols and the structure. Viene Vidamon, for sure that we are going to, hey, you have your day off, or you are with your family. We have to respect this side, but they have to be also professional and understand that we are in an environment that they have to respect some things also, because it's like, okay, I give to you, but you give to me.
Mm-hmm. Mm-hmm. Yeah, fully understood. If I may move this a little bit to a clinical perspective, and I'm putting the three of you a little bit in boxes. I realize that, so please interrupt each other as well and chip in. But from a clinical perspective, I look at you, Irfan. What are the most common concerns raised by staff or players when they observe Ramadan?
Yeah, it's a really interesting question, Eva, and I think some people's natural inclinations or thoughts are to think about, in a data-driven, in a performance environment, we're thinking about injuries, challenges, problems, but actually, by reframing the clinical discussions into more of a positive approach, I find that's really useful. So the first thing is I tend to sit down with players and say, we're going to have a discussion here, but I want to rephrase this. I want to talk about how we can optimize your performance, reduce injury risk, and optimize your loading and also nutrition. And everything we're going to discuss here is about that. And I think that's a really nice way to ease into the conversation. Over the last couple of years, we've been developing this pre-evaluation health assessment tool. We presented it last year, 2 years ago at the IEC, and hopefully it will be out in publication soon. But really, there's 6 steps to this. And I think if you follow this stepwise approach, you're not going to go far wrong. Okay. So the first thing is fasting requirements. And Karim mentioned this. Ramadan happens once a year, and those requirements are very different depending which part of the world you're in, where it's a 13-hour fast or a 19-hour fast. And naturally, as I'm sure you one will reflect on, that will change your approaches to nutrition and hydration. Secondly, a walk into the environmental conditions, and we talk about heat, altitude, coverage, workload, bulb temperature, and understanding some of the clinical challenges and from a performance perspective. Step 3, kind of asking our players about what's the aim of this training block. So we have a month, 29 or 30 days where you've got games. What is it that we aim to achieve from this block with the games and also training environment that we have? 4, your nutritional plan, and I'll hand over to Juan, and I'm sure he'll discuss more about that later. And 5, training load. And the reason why I mentioned earlier on we try and do it a month before is because we like to get some baseline data. What is their baseline training load? What do we anticipate we could achieve during that 1 month time? And is there something we need to adapt from that? And secondly, and finally, from step 6 is the drug history. And people often get very anxious and worried about medical history and exemptions. And I think it's worth bearing in mind, by the time a professional athlete has got to this stage, they would have navigated many Ramadans in an academy sport level, at an international and professional level, and perhaps navigated this by themselves and may have developed their own strategies for that. There are a few and far exemptions from fasting, particularly between male and female athletes, and perhaps we'll go through that a little bit later. But certainly the drug and medical history is very important. And by the time you've understood the training demands, environmental aspects, and that 6-step approach, I think you can have a really engaging conversation.
That's a good lead up. Yeah. And for those live here or viewing this later, we will share the outcomes of these 6 steps once it's published on a LinkedIn group as well to share that. You mentioned data, Irfan, so that brings me to research maybe a little bit. Just quickly, Karim, I understand doing research on this topic is quite difficult because it only happens once a year. So you need to frame all your research around that time. So having said that, what do we actually know about Ramadan and fasting and performance and recovery? And where do you think we have more assumptions rather than hard evidence?
Yes. Before that, I don't know if everybody attending tonight, I think that everybody knows that Ramadan is fasting from dawn, not sunrise, from dawn. It happens 40 minutes to 2 hours before sunrise. So it's longer than what we think. To sunset, iftar. So usually the athletes, and I'm looking at Juan, should be eating their suhoor, last meal before attacking the fast, the latest possible. Because if you eat at midnight and go to bed, you will be fasting from midnight to 6, 7, 8, 9 a.m. The day after. This depends on the season, of course. Because if you are in the summer, in the northern hemisphere, June, July, and you live at quite high latitudes, UK or above, you'll be fasting for 18 to 20 hours. It's very much challenging. It's not the same Ramadan as living next to the equator in Qatar or even closer, where you will be fasting 14 hours, 15 hours, and there's no much difference between summer and winter. So people should understand that the conditions, the length of the duration of the fasting, the associated environmental conditions, heat, humidity, or cold weather, are impacting a lot the things I will tell you a bit later on, if there is a negative effect or not. So, and these are only a few contextual aspects, not taking into account the spirituality, the motivation of some athletes, because depending on the degree of religiosity of the athlete, you can have extra power, extra motivation. We have written articles on this with Juan on nutrition, hydration, and with others on spirituality and motivation. They are in a special issue in La Tunisie Médicale, published in the issue of July 2025, just here. So we have written into this, and in this special issue, there are at least 2 new articles that we didn't use to find before. Is the one about spirituality and the strength behind psychology, and we all know the toughness of mental strength. And the second is a qualitative study where we interviewed athletes, doctors, fitness coaches, physiotherapists in Muslim majority countries where it's relatively easy to fast, and in Muslim minority countries, for example, France or UK. In France and UK, you are not in the perfect environment to be fasting, because everybody around you, almost everybody around you, does not fast. The coach does not change the training hours, etc. So I will stop here, but to tell you that whatever we discuss today is immensely depending on the individual and the context. Okay, so you asked me about performance. I will try to be short because I will leave the rooms for others, and I can develop later on if you ask me deeper questions. But the literature shows negative effects of Ramadan, especially in the afternoon and not in the morning. It's understandable. In the morning, the fast is very short. But also a lot of papers does not show any negative effect of Ramadan. For example, if you want, let's touch base on football because we are at the UEFA. If you want to know, does Ramadan impact the physical performance? So your time motion, your number of sprints, etc., this distance covered during a football match. We have 3 studies only done so far. One done in Malaysia, in sub-elite level, in hot and humid conditions. Here, Ramadan effect was drastically negative. The study of Aziz and colleagues 2018 is very clear. Very strong negative effect of Ramadan. The 2 others, one done in Russia by Berzuglov and colleagues 2021, I think, and the latest one from Qatar, Di Salvo and colleagues 2025 this year, show no negative effect. So in Russia, no negative effect, elite level, first team, first league in Russia. But in Russia, the temperature was 16 to 19 degrees. It's not like in Malaysia. And the players who were fasting were used to fast for many years. This plays a role also, because young children, young adolescents, when they fast for the first time in their life, we have published this, the performance is steeply decreased, is very much impacted. And the other study from Di Salvo et al. And colleagues just published this year from Qatar is the Qatar Stars League, where in Qatar, probably you know that this Muslim majority country shifts everything at night. So during Ramadan, players train at night and play at night. So they train and play in non-fasted, in fed conditions. So no negative effect of Ramadan on performance. Later on, after the other speakers, I can come back to the injuries, because there are two papers on injuries if you want. So my answer is, Ramadan could have an effect or not an effect. It depends on many things.
Context is really an important thing here. Yes, I fully understand and appreciate that, and I think our audience does the same. Probably there's some positive experiences and also some negative experiences. So feel free to share anything you want to share in the comments, and any questions you have as well. Then we can pose them to our experts here. What we did is we prepared 3 really simple cases to go through. So let's go to these, and let's stop to just think into thin air, but let's have a look at what could actually happen. The first case we have here is a fit and available player. So this player is fully fit, observes Ramadan, they report to feel well, they train normally, they do not ask you for any specific adjustment, but the timing this year falls, especially in Europe, then within this season's Champions League knockout phase. It just starts at that time, so you can expect that there's a few high-level matches to be played for certain players, and let's assume this is one of those players. So on the surface, everything seems fine. So I'll open this one to the group. Maybe start with an open question. Is no complaints for this player the same as having no risk of any adverse effects?
Dr. Ahmed and Juan, you can speak. I was speaking now, but I'm just waiting.
Yeah, I really like to hear you. No, listen. Well, I think in this case that you are proposing, the player is not going to report any fatigue. I'm 100% sure, because they want to play. They want to play because it's a knocked out UEFA Champions League, I think. So you can see, like in the wellness, every player will report that they are 100% available. That don't mean that it's a reality. Normally, it's not true. More at the end of the Ramadan. I have an example. I would like to use a real example for this situation that I lived last season. We were playing knockout Champions League match. I think Ramadan last season was in March, end of March, right? So yes. We play to qualify to quarterfinals. So we had 4 players doing Ramadan, observing Ramadan, and we lose in Paris 1-0 against Liverpool, and we go to Liverpool trying to go through quarterfinals. So these players comes to me to ask, "Hey, Juan, what we do, because the game is just before iftar, so just before warming up, and it's the most important game of the season, and we normalize the situation. Like I said, hey, don't worry about this. You should, or you must follow the instructions, and that's all. Trust, Okay, we did the strategy, the protocol, and we arrived to Liverpool. We did the pre-dinner match. So when we arrived, and at 4 a.m., it was the strategy. 4 a.m. in the morning, I woke up with the two chefs that they are traveling with the team to prepare the meal of Sohur. So we agree, all the staff, the players, me, that we will do that. Okay, so I knocked the door at 4:30, and we give the pasta, the smoothie, cereal, all the sugars I can give, trying to avoid the digestive problems. Okay, after arrived the match, and we had the second strategy focused in supplementation. So we give the things that we think will be useful, and I can say probably it's not because of this, but if you remember, this match went to the extra time, and after penalties we go through, and the workload of those players was amazing. So after the game, they came, "Hey, Juan, thank you so much for this strategy," and so okay. And this season they want to follow the same strategy. It's like, okay, we are here with our strategy, trust, and the things happens. I'm not saying that because of this strategy we win, or they have an amazing workload, but I'm saying that we are here to help them, and that was I feel really proud, because was like a collaboratively work of the team, players, staff. So and we normalize the situation. And I think is one of the key, normalize the situation of Ramadan, because as Karim said, if you manage properly the situation, the performance will not be impaired, I think.
Yeah.
Sorry for the question.
No, really good. I like this. This is exactly why we have no slides. We get honest and honest questions that really are practical, right? Yeah. I think this relates maybe to one of the questions that is posed in the chat as well, and that is a little bit about this contextual factors. I think Karim just alluded to it. Juan, you gave a proper example of it. But one of the questions is what can accommodations or organizers of or within clubs do to to change things within the context to make it easier for players to observe Ramadan. The question here is specifically about changing game times or make late evening training available, change meal times and these things. Now, I assume, Karim, based on your previous answer, that's a little bit difficult and tricky based on where the majority of the faith lies within a club. But what can we responsibly do? Maybe a question for the three of you.
I mean, as Karim said, will be perfect. Change the training schedule to adapt for players doing Ramadan or workload. But in Europe, normally that don't happen. So the only thing, for example, in my expertise is to explain the staff of the players, the coach, the probably negative impact to the fact to train dehydrated, for example. Only like this, they have the information. Probably they are not going to change the training sessions. That happens, but try to give the things that they need, suhoor, iftar, and try to manage properly. Good organization is the key. Good organization.
Yeah.
Discipline, yes, discipline. Ahmed, do you want to say something? Because I have to say things about
he's
the
a bit
training.
quiet.
Thanks for that. I think when we talk about preparation for Ramadan, particularly when you say there's no problem, it's all about the language and also how we can involve our staff in these conversations. You'll probably have an idea from your pre-season screening, your pre-health evaluation tool about how we can improve your athletes' well-being. And I really try and frame the conversations in the language that you use. It's a month of development, very spiritually, and I'd use that same word, development, and how we can maintain your performance. And I think that's a really easy way to get in. I'm speaking mainly to an audience of people working in sports medicine, and I'm conscious of the fact that, look, by having these conversations and by embedding this into your club, particularly at the academy levels, all the way through to the professional levels, that you get to a stage where your players, both female and male, would have become accustomed to preparing for this season after season, and it becomes a culture rather than something that's new. And we found that this helps to improve performance and well-being within the club. It improves rapport and inclusivity within the club and also the organization as a whole. It's a message of support. So rather than them having to volunteer a problem, you're engaging actively with them. And there's definitely greater and improved communication between the medical team all the way from our very data-driven analysis from strength and conditioning, physiotherapy, rehab, and sports medicine departments. I think, Juan, you hit on a really nice point earlier on. When we live in a sports medicine community, which is data-driven, which is performance-based, it is fair to say there are some intangibles from the month of fasting, and it's important that we acknowledge that and how best we can accommodate that alongside the data that we're getting and the readouts. And having that pre-planning a month before can be really useful. So I think having that culture is really important. And being culturally aware and understanding many of these players have had tactics they've used. How can we optimize? How can we work with them? As Juan said, we don't want people to be reporting problems. We want to be ahead of the game and supporting that performance. And nutrition is such a big impact alongside that.
Wonderful addition. Thanks for that.
That finished well, but I remember in the first year I was working with players observing Ramadan, was in 2016. I was a disaster in Ramadan because it was my first season in France, I remember, and I had players with cramps. It was like a disaster, So after that, I said, hey, I had to learn about this, and that couldn't happen. But the context here was different because it was in July or August, I think, in 2017 or 2016. So
Yeah.
Yes.
There's a really tangible question for you, Juan, but Karim, you go first.
Yes, I think that it's important to watch your words. When you are supporting staff around the players, whether you are technical staff or medical staff, you have to watch your words. If you inside you are convinced that Ramadan is negative for performance, and oh, Ramadan is coming, what will we do? And this guy will be fasting, and he will be at high risk of getting injured. So even your facial expression and your words will be really counterproductive. First, watch your words. Second, in the preparation of Ramadan, you need, of course, to have a truthful contact with the player. If the player feels that you are here to support him and you will keep the secrets you have to keep towards the coach, because as Juan said, everybody wants to play. And out of Ramadan, if I'm tired as player and I tell to my fitness coach that I'm tired, it's for my fitness coach to help me, not to say to the coach he's tired and the coach says, okay, I'm gonna let Everett play instead of Karim. Okay, this is from the field, the reality from the field. But you can not only we don't have evidence on this, but I would strongly suggest to do it. You should be fasting before Ramadan. Do training of Ramadan. So in Islam, in the religion, there is Ramadan, which is compulsory. You have to fast during Ramadan if you're healthy, if you are adult, if you are a woman and not having your menses because you are exempted. There are some conditions. But there is also something which is sunnah, which is not compulsory, but is good for religion, which is fasting Mondays and Thursdays. So people who really want to apply religion, including sunnah, will be fasting all year long. Mondays and Sundays, for example, Mondays and Thursdays, for example. Also 3 consecutive days in the middle of the month, the lunar, because Ramadan is lunar month. When the at full moon, so these are trainings. I will not tell you, ask your players to fast the whole year, but at least 1 month before Ramadan, he should be training in fasting conditions. This will prepare the physiology and the psychology to the coming Ramadan. So, because if you don't do this, the abrupt change from non-Ramadan to Ramadan is completely upside down. Night is day, day is night, and the first week is really very challenging if you did not prepare. So if you prepare, I believe there's no evidence that the first week would be less challenging. So this is important. So trust, speaking with the players, and as Juan said, we are here to help you. The big error not to do is suggest to the player not to fast. I really strongly, extremely strongly discourage you to do this, because this is faith, and you will completely destroy the relationship between you and the player. He will say, what?
I think
This is my faith.
I agree totally with Karim. Sorry, Karim. I agree totally with you, because in fact, I think we had to train. Ramadan is like, hey, Ramadan doesn't start the first day of Ramadan. No, it's starting before with an education plan, and also trying, for example, in some training session, don't give hydration. For example, the player is going to get used to this situation. Also, as Karim said, Sunday of fasting day, like this is like a normalized situation when it's when Ramadan arrives. It's not like oh my God, now what we do is an urgence. No, normalize. It's arrive, and we do as we train. It's one of the keys also.
Yeah, we do it for altitude. Juan, we do it for altitude. We do it for going in countries where it's hot and humid. So we do acclimatization. This is a bit different, but we do this. We prepare. Why don't we?
But for Ramadan, we wait until the first day. Eh? Hey, don't eat.
Yeah, doesn't work. Yeah, that's a really good addition, Karim, and I think a lot of us forget that at times, that you can prepare for it really, really well, and you must. So thank you for sharing that. We have more cases prepared, but we have 2 questions in the chat that I would like to bounce off of you. Juan, maybe this one is for you first. You just mentioned a supplementation protocol in your example, straight after the case. And there's a question about what was the recommendation in that supplementation protocol to the player?
Well, the supplementation for these cases is mainly carbohydrates. You know, it's like energy drink with isotonic. It's a full, yes. We have gels without or with caffeine, depend of the player, because not all the players support the same caffeine. Isotonic drinks. I don't like for this situation to give solid food because we try to avoid digestive problems, and in the halftime continue with this strategy, trying to reach between 40, 60 grains of carbohydrates in the halftime with in form of gel and drink. We can have also gummies if some player feels not too very good and they don't want to drink or they don't like the gel to arrive to this quantity. And at the end of the match, for sure, before the extra time, again, you know, and you need to train this also, because if you arrive to the match and take during this period of time, 2 hours, 120, 150 grams of carbohydrates, I honestly, I go to the toilet directly. So try to train this during the week in other games to try to normalize again.
Yeah. So also the supplementation protocol needs to be normalized before it's there. Another question, maybe for you, Irfan and Karim together. In the country of the person asking the question, the fasting period will be from 5 a.m. to 5:18 p.m. What do you suggest would be the best time to train? Is that in the morning, like around 9 or 10 a.m., or closer to iftar, like 2 or 3 p.m.?
Irfan, you or me?
I'll let you go first, and then I'll try and pick the bones between them.
Okay.
Yes. So if you have the choice for training, there are 3 obvious options. Early morning, here no effect of fasting because you are just having your suhoor. The problem is recovery. And this person asking the question is really lucky, because 12 hours of fasting is okay. Hallelujah. The other option is just before iftar. This has the advantage of being able to replenish food and fluid just after the session. The problem is that you have been fasting for 10, 11 hours or more. For these sessions pre-iftar, pre-sunset, we recommend doing more technical, tactical sessions. So not too long, 45 to 60 minutes, and not very intense. If you want to do intensive session, heat, interval training, heavy resistance sessions, it's better to do them at night. By the way, I come back to 10 minutes ago. You can speak with the coach if you are in Liverpool, in Paris Saint-Germain, or whatever. You can speak with the coach, and usually the coaches are very open-minded. And you say, okay, Karim will be fasting, so for him, the heat session, he will do it at night. So when the Paris Saint-Germain trains in the afternoon, he will be here because he's part of the group. Or if you agree, we leave him asleep, it's better for him. But at night, the fitness coach will be with him, and he will do the same session as the others. So this is 4 weeks. During 4 weeks, you can individualize the sessions for some players, some of the session, and you can pass Ramadan easier with this. And I tell you, if you do this for the players, if you do this for their faith, they will repay you on the field. I tell you.
Any nuggets to Romania, fan?
Yeah, thanks for that, Karim. I think you know, from the evidence, obviously, if you train early in the morning before the suhoor or the meal that you take before you start the fast, Obviously, that gives you time to recover. I think within this, it's important that the intervention should meet the training needs. So what is the purpose of this training session? Is it for recovery? Is it for maintenance? Is it for adaptation? And as Kareem says, if you're doing a heavy or hard session that's a high intensity, after the evening meal is probably the optimal time. If you do one early in the morning, we do think about those other impacts. So we think about, there's a paper we wrote on intermittent fasting, eating by the clock for health and exercise performance. It's available on the BMJ Open. And it talks about the different effects of fasting. So this circadian rhythm impact, so the impact on that. And if you've trained really hard in the morning, some of our players prefer to sleep between after that morning prayer and their first training session in the morning. So it's very difficult to sleep straight away afterwards. That may cause some impacts on sleep, which is an important part of recovery. The second thing is if you train more towards the afternoon, you may not be able to do the same intensity for as long if it's more than 60 minutes, but it gives you that time to replenish and get on that nutritional support as sooner rather than later. And then Juan, I'll be interesting to hear your thoughts on how quickly you try and get protein and carbohydrate intake after a session. And thirdly, it's important to the fluid volume and also monitoring hydration status and having a plan for that is very, very important. So I think we can have the perfect plan based out on the evidence, but actually thinking about those other impacts on sleep, recovery, and how that fits in with the training schedule of the team is really important. What we've noticed is, as Kareem said, having those discussions with the coaches and the players really early. We've found that coaches and SSC staff and physios are really open to those discussions. And if anything, we've had other players volunteer to do the sessions in the evening with the fasting players because they want to feel part of it. So having that opportunity to think about how can I change the environment? Do I work in a club that has a domed environment? It's a very warm, very humid environment. Could I change the environmental conditions? Can we have an indoor versus outdoor session for that particular player? If they've got a specific S&C block, can we change the timing of that to optimize their recovery? And how quickly can we get that nutritional support on board? And how does that fit in with the game? We've had examples of games having food and water breaks in previous seasons here in the UK to accommodate that iftar time or that breaking the fast time. But we're interested to hear your thoughts, Juan, on how quickly you like to get those macros in and what your best strategies are.
Back to you, Juan. He's thinking, is it that?
I don't know what to say.
No, let me speak. Let me emphasize sleep, because Irfan was mentioning sleep. We spoke about recovery. We know the importance of sleep. And not only you can accommodate and try to have the best sleep during the nighttime, even though in some countries there's no nighttime sleep because the players go to train at night and then they go to mosque and then they go to see friends. So they're awake all the night. So if the day after you don't let them sleep, it's problematic. And you have also the possibility of adding some napping. Napping would complement the main sleep, which is really impacted. Usually players lose 1 hour of sleep in duration during the Ramadan every night. So sleep is super important.
Nutritionists, we have guidelines, normally guidelines that you provide us, Dr. Ahmed and Karim, with the research, these kind of things. We try to follow guidelines. For example, okay, my player has to arrive to take 160 grams net of protein whey or protein normal during the day. How I'm going to organize this in 2 or 3 meals. I would like this player take this quantity of carbohydrates because we play tomorrow. How I'm going to organize. So at the end is organize. So the 3 things, I have to say 3 things to control for a good organization during Ramadan is carbohydrate refueling, sleep deprivation, and hydration. I have control. I have to control these 3 aspects. After there are another ones, like for example, I'm watching a question from Nicolas de Oliveira saying that if there is some recommendations for women. Yeah, for sure, because we are talking that women has a menstrual cycle. So depend on the moment of the menstrual cycle, the energy needs are going to be different, So the context, again, is different. So at the end, it's not perfect, but we are going to try to arrive 100% individualization, because all the player has different energy needs. They have a different response. In Ramadan, they sleep better or less or more. and we have to individualize and try to do as best as we can, you know. So if we manage this aspect properly, I think again, Ramadan will not be a problem for health and performance, in my opinion.
Can I comment on something from
Please
reality?
do.
Three years ago, 3 Ramadans ago, something marking happened in UK, in the English Premier League, because during the game Crystal Palace and Leicester, the two doctors, and one of the doctors is Zaf Iqbal, that I salute because I think he's attending. He's now the doctor of Arsenal, you know, a small team there in UK. They came to Milano, to my Inter Milano, and they beat us 3-1 in Milano. These doctors spoke with the referee and informed him that there was one player fasting in each of the teams. The referee, without consulting the FA, he decided to allow the players stop for 2 minutes and go eat and drink on the side of the pitch at the sunset. This went viral online, and then the next games, other referees did it, and then the FA took responsibility. And now in the UK, when the game is played at sunset and there's at least one player fasting, the referee stops and allows a water break for the player. I love it. In France, it's not the case, and Juan will confirm you that. So the different approaches show you that I think there is a lack of information around football, and this is why we wrote the special issue on Ramadan and sport published in July 2025 to try to disseminate more knowledge to render the thing more normal, you know, because there's so much tension around Ramadan and the religion, and you know, we just discussed many examples where there is no problem. When it comes to injuries, because I think we speak about the player's health, and I'm quite sure that the doctors attending would like to know, are there more or less injuries during Ramadan? So what do you choose? So unfortunately, there are only two studies. One study done by me and my colleagues published in 2012, long ago, and the second one published by Cristiano Eirali and Arspeta Group the year after, 2013. The first study from Tunisia on only one team over 2 consecutive Ramadans, where I knew exactly who was fasting, who was not fasting, etc. With these small numbers of injuries, we had a significantly increased number of what we used to call overuse injuries, tendinitis, and so on. So if you look at the study from Tunisia, there are more injuries. During Ramadan. If you look at the study from the Aspita Group 2013, there was no difference between Ramadan and pre-Ramadan. The big difference between Qatar and Tunisia is that in Qatar, as I told you before, they train and play at night. In Tunisia, we used to train at night, but the matches and some training are during the afternoon when you are in fasted conditions. So there is no definitive conclusion, robust data. There's the microphone should be muted. And we need more research on this. But again, I will parallel this to a study on physical performance. But listen to this. Published in 2008. It's the national team of judoka from national team of one country, training in a closed camp with the coaches and medical staff living with them in a closed camp. So very well controlled sleep, very well controlled hydration, very well controlled nutrition. In these judoka athletes, only very few performance measures were impacted. It was the 30 seconds continuous vertical jumps, the unique vertical jump, the sprints, and the yo-yo intermittent recovery test level 1. All these measures were not affected because these athletes were elite athletes, eating very well, sleeping very well, hydrating very well. So context. But unfortunately, to conclude, only 2 studies on injuries, one showing a negative effect, another one showing no effect.
But the context between those studies were different, weren't they, Karim?
Exact. I told you.
So, yeah. Okay, that's a good addition. Now for the audience, just so you know, we prepared 3 cases and we're still stuck on the first one. So I think we will not even get to the others. There's so much to say about this topic. So definitely not the last time we're going to talk about this in this way. There's a question from someone from Qatar, and they wonder whether it's convenient to have goals with apostrophes or some limits in body composition in the month of Ramadan to keep muscle but not to go too high in fat. That's the actual question. I hope you understand that.
Usually, body composition does not change a lot. We have also written systematic reviews on this. The only issue is related to, I will pass the ball to Juan, because dehydration over 2% of the body mass is problematic. So keeping hydrated. And of course, losing muscle mass is a problem. So you need to keep some gym, some muscle strengthening there. And of course, all the proteins that go with it. But if I have a problem with this, is more dehydration than nutrition, because nutrition usually there's not a big problem, even though the eating window is short. Athletes eat as much as out of Ramadan. This has been shown, and we have published this.
Yeah.
For body composition management, the thing I do during Ramadan is, well, I know the body composition of the players before the Ramadan, so I know if they are in a good condition or not. They arrive to Ramadan, for example. We will put an example of a player with 75 kilos, with a good fat percentage, good muscle mass. So we can, as Karim said, we have to pay attention if someday the weight is very down, for example, 72.5, that something happens, So I try, for example, if this player is around 74, is finishing the Ramadan in 73.5, 74, is a normal thing. But after match or after a training session, I try players control their weight to see what happened during the training session, to be aware for iftar, So, in my opinion, weight we have to control every day for professionals. I mean, to see good, big variations in body weight, but for hydration, because if we are managing properly with protein intake, carbohydrate intake, normally the problems will arrive with the hydration.
You said something interesting there, Juana. Maybe this is a good way to also bring Irfan back into the discussion. There's a question in the chat about we're talking about professional athletes so far, high-level athletes, but how about recreational athletes? Should we prioritize on different macros, different supplements in recreational athletes, or is it similar lessons?
Could you repeat the question?
Well, how about recreational athletes? That's basically the question. I just put a lot of words around it, but
amateurs, not professionals.
Okay. No, I mean, all these recommendations should be for professional and amateurs. I think for everybody. I mean, everybody that do a sport, because we are talking about health. Okay, probably I'm going more to performance because it's my nature, but I think if we don't have health, we will not have performance. So
yeah. Irfan, can I?
Yeah, I think Karim touched upon this right at the beginning when he mentioned the difference in studies between the sub-elite and elite cohorts, and I think that's really due to our preparation. And it's important that we get our preparation right, and really by preparing well, we're going to mitigate as many of the challenges that we're going to face and really optimize our health. As a sports medicine physician, I can't end the talk without talking about medical kind of emergencies and medical screening. I think we're all quite familiar with thinking about things like cardiac screening. We're very familiar with periodization, training blocks. And having a part of our discussion where we talk about the medical history and talking about exemptions is really important. For instance, for the female athlete, pregnancy, breastfeeding, the time of menstruation, having a discussion with the athletes and pre-planning this is very important. There are two specific examples that cause a lot of anxiety with sports medicine physicians and physiotherapists working on the pitch. And that is really how to manage sometimes patients or athletes with chronic disease, most notably something like asthma, which can be something that's very well controlled. Rarely are people on tablets for it, but there may be some conditions where you might be thinking about the timing of the medication. How does that control their long-term management? Is there a way to switch a tablet from a very fast release to a modified release? And do I have a plan in place for monitoring things like respiratory function, sugar control in patients who are at risk of low sugars? If we had a medical emergency, have we built that into our EAP? Can we have discussions with the athletes? If this was to happen, we would think about doing this for your welfare and your safety. They're very, very few and far between. But having those discussions early can often get rid of a lot of anxiety around what to do. So I think that the drug history and the medical history, which is step 6 of the periodic health evaluation, is really important. And you'll know that from your screening tools that you do with your athletes at the beginning of the season. I think by having an early input, that's really key. But definitely it's just as important in amateur athletes. Juan, I'll hand over to Juan, but I think in terms of macros, in terms of protein, carbohydrates, and fluid volume, I think it'd be really nice to have a summary, Juan, if you wouldn't mind.
I'm watching here a question is interested that talks about protein, fats in Sohur. So I would like to say, to answer this question, yes, for sure. If your last meal was an iftar, imagine that you don't give a protein in the Sohur. So we can pass 24 hours with no protein, so it's not possible. In this meal, you should give protein, and in form of casein probably could be a good option because the absorption will be more delivering the time. And for sure, fats. I think that you have to give fats also more in good fats, like for example, polyunsaturated, monounsaturated fats could be nice. So yes, my answer is for sure. Sorry.
Great. I must admit to the three of you and also to the audience, this hour flew by. We're already almost at the end of the webinar. Yeah. And we had 2 more cases, imagine that. So no, this was an amazing talk and an amazing discussion. And we got good feedback in the comments, people applauding the 3 of you, sharing your thoughts and insight and expertise. So thank you very much for that. But before we wrap up, I want to ask 3 of you the same question, so really brief. And let me start with you, Karim. Same question for the 3 of you. What is one thing you wish teams would stop doing when managing Ramadan? And what is then one thing you wish they would start doing instead?
Stop doing is that, unfortunately, some teams in several countries, some coaches say to the players, if you fast, you don't play. It would be nice stopping doing this and rather helping the players. And for a second question, what they should start? Yes, helping the players to be as performant as possible while fasting, because if you do that, they will repay you on the field. If they have their high religiosity, you will find unbelievable strength behind in their mind.
Irfan, can I go to you? Same question.
Yeah, they kind of link. I would stop waiting for there to become an issue for it to be during Ramadan. I'd prepare really early. I'm a little bit biased, but I would institute the periodic health evaluation form and the 6 steps, going through the fasting requirements. What's the environmental conditions? What's the aims of training in that block? What's our nutritional plan? And how we're going to monitor training load and the medical and drug history. And if you do all those 6 in a nice conversation, 20 minutes with your player, sit down, have a nice conversation a month before, I don't think you'll go far wrong. So that's what I'd do.
Great. And then last but not least, Juan?
I will stop putting the players in the spotlight the players observing Ramadan in the spotlight. I will stop this. And I will add respect for the player's decision.
Great. I think these are really good take-home messages for the audience. So I thank the three of you very, very well. And like I said, definitely not the last time we're going to talk about this topic. But we know where to find the expertise now. Thank you. Thank you very, very much.
Thank you very much.
Thank you.
Bye.
See you. Ciao, ciao.
So before we let everybody go, to close, I think if there's one overarching message from tonight, it's that managing Ramadan in football is not about rigid rules. It's not about a one-size-fits-all solution. Yes, we have guidelines to help, but it's a really complex topic, and we have to adapt our care to the context, whether it's men's football or women's football. We try to keep it generic as possible tonight. We heard about the need for acclimatization, seasonality, culture, spirituality. So a lot of information to take home and to digest. Thank you very much to our guests for an open and thoughtful discussion. And thank you to everyone who joined us live and contributed with a question. It really made the discussion alive. So I hope you like this format. We also hope that this conversation helps you approach Ramadan, the upcoming period, with better confidence and clarity. And before we close, I would also like to highlight our next webinar, which is on February 3 this year. Of course, it's on groin injuries. And we have so far Paul Dijkstra, and we're looking for a second excellent speaker to join us. And it will be a similar setup where we present cases and you can share all your thoughts, suggestions, and questions. We'll share more details shortly via our usual channels on that one. And finally, please take note of a medical symposium, which is in 2027, February 2nd to 4th. More information will follow soon as well. For now, have a very good evening, and we look forward to welcoming you to our next UEFA Medical Webinar.